Alors, bonjour et bienvenue à cette conférence.
Hello and welcome to this press conference of the Premier, Mr. François Legault, together with the National Director of Public Health of Quebec, Dr. Arruda. Hello, everyone. It is now Danielle McCann's turn to take a day off today. I took one yesterday, and before starting, I want to thank Geneviève Guilbeault. I find it encouraging to see that there are strong people, a woman with a lot of presence. So thank you, Geneviève. I took advantage yesterday to go for a walk. I even met one of the journalists, but I met, I would say, about 100 different Quebecers, and it really gave me a lot of energy for the upcoming days. I didn't see anybody who looked down. On the contrary, I saw people who were smiling, who were confident, and who were encouraging me, and I thank them today. And it's going to be our challenge in the upcoming weeks to remain with confidence, with hope, keeping a positive attitude and our spirits up. The more weeks go by with the situation, which is difficult, staying everyone at home, it's important that we concentrate in keeping our spirits up, that we remain united, very important. Even though we are distant and sometimes we're alone at home, well, it's a bit of a paradox, but we have to be more united than ever. And I know that the Quebec people are capable of being united and getting through this challenge. I also wish to say bravo, Quebecers. The vast majority of people who have met are keeping their 2 meters apart with other people. Of course, when it's a couple, if they sleep in the same bed, well, they don't have to keep 2 meters apart when they're walking, but I saw that everybody else was respecting it. I also wish to thank the 3 leaders of the opposition, Manon, Pierre, Pascal. I speak with them twice a week. They bring me a lot of good suggestions, so it really is very pleasant to be working with the 3 leaders of the opposition. We are together, and I wish to thank them for their collaboration. Now the numbers for the new numbers. Good news, we are still at 22 deaths. If we look at confirmed cases of confirmed people, we are now 2,840, an increase of 342. 192 people hospitalized, an increase of 28. 72 people in intensive care, which is an increase of 15. We are now at 58,000 tests. We're one of the places in the world, with British Columbia and Alberta, and I'm speaking about the world, I'm including the United States and Europe in this, where we test the most. And I did meet a lab technician yesterday. Thank you to nurses, technicians in the labs. We are amongst those who, when we look at it proportionally, are testing the most in the world. So that's very good. What's also very good news, the number of hospitalizations is still limited. When we're telling you that 192 people are hospitalized and there's 6,000 beds that are ready to welcome more, you can see that we have a lot of leeway and we are ready for the worst case scenario. And what it means, according to Dr. Arruda, is that our measures are working. So this is encouraging. I want to go back to the measures that we announced yesterday concerning the borders for the northern and eastern regions of Quebec. First, if you look at a map of Quebec, you'll understand right away what it is that we're trying to do, is that the entire northern and eastern part of the province, so Abitibi, northern Quebec, Nunavut, the Cree lands of the Bay James, Saguenay-Lac-Saint-Jean, Côte-Nord, and in the east, the Bas-Saint-Laurent and the Gaspésie, those are all regions where, proportionally, we have fewer people who are infected than in the southern part of Quebec. What we want is that it stays that way. So I promise you, we're going to go see you up north when all of this is over. But for the time being, it's a good thing that there's fewer people in the north and east of Quebec. So we're asking people in the southern area of Quebec to not go to the north We also made sure to take some precautions with New Brunswick so that it's the same thing. Now, the two regions where, keeping in mind the proportions when we look for 100,000 people, where there's the most people who are infected remains Montreal and the Eastern Townships. Today, we've asked the Montreal and Eastern Townships authorities to give more information on the neighborhoods that are affected. So in Montreal, there's certain neighborhoods. In the Eastern Townships, there are cities that are more affected than others. So just to avoid people walking around or going around in those areas, I think it's important to inform us. And so today I understand that the people who are responsible for those regions are going to reveal that information in the most affected neighborhoods. The other thing that I would like to repeat, of course, in particular, don't go to the north or eastern parts of Quebec. Do not go to the eastern townships or Montreal. But generally speaking, don't wander around from one region to the next. Yesterday, we announced that we were now banning renting cottages. So those who have a cottage, if you are in your cottage, you stay in your cottage. But we don't want people to wander around between the different regions, in particular on the weekend. The people who remain the most vulnerable are elderly. So today we are announcing Marguerite Blais, our dear Minister for the Elderly, is going to have interviews by tomorrow where she's going to record or she's going to make a video because she's confined. She confined herself. But what we wish to do is to add a lot of resources in CHSLDs and residences for the elderly. So there's 3 groups of people who go in and out of those residences. There's the staff, there's those who come and deliver the food, and there are, of course, the residents themselves. So what we wish is that there be better control of that there be, security guards, and that we check people's symptoms at the entrance. So I've been telling you since the beginning, the places where there's more vulnerability are residences for the elderly. Yes, there are a certain number of them that already have infected people. We're taking the measures together with the additional staff. We'll be able to make sure even more that these measures be taken. But of course, we have to also make sure that all the people who go in are controlled in order not to bring the virus. My daily thanks. The people who deliver the food. Right now, we have people, elderly people that we're asking to stay home. We have people who are quarantined. We have people who are vulnerable. We have people who don't have money to buy food, so they need the help of food banks. So there's a lot of people, and a lot of young people, and this really impresses me, and I love seeing that. So all the deliverers of food, thank you very much for what you're doing. You really have in your hands an essential service. I would like to end by repeating the plan to you. 3 things. Don't go out if it isn't necessary. If you do go out, stay 2 meters away from other people, even if it takes you a little longer to do your groceries. Go alone. It's better than going 2 people. And when you come back from buying your groceries or your walk, you wash your hands with soap during 20 seconds, as our good Dr. Arruda showed you. So that's how we're going to win the fight of our lives. I count on you all. Thank you.
Like many of you, I had a walk yesterday. I received many cheers, and it's my turn today to cheer all Quebecers. Keeping our physical distance, we are closer than ever. We can see that the daily increase in confirmed cases seems to be stabilizing. Public health authorities tell us our efforts are paying off, so don't give up. We must especially continue to protect the most vulnerable. So that's why we're announcing an emergency aid for housing residences for the elderly. It will help us better protect them and protect the staff. As I've been saying in the last few days, everybody must follow our battle plan. That's how we'll win this battle. I count on you. Thank you.
Nous en sommes maintenant à la période de questions.
We are now the question period.
Bonjour, messieurs. Jusqu'à maintenant,
Up until now, you have set up measures day after day,
de manière très graduelle.
very gradually.
Ça a commencé par les écoles.
It started with the schools, with businesses.
J'imagine qu'on-
I imagine
on
that
aussi que,
we should
ce sera pareil
imagine that it will
pour
be the
la sortie du
same
confinement,
for
c'est-à-dire
the end of the
graduel,
confinement, that it will be gradual and
Est-ce que
progressive.
donc, on doit s'attendre à ce que
Should
ce
we
soit
expect,
toutes les
therefore, that not all
entreprises qui pourront
businesses
réouvrir
are
à
going to
partir du
be
1er avril?
opened as of mid-April?
Effectivement,
Well,
on aura un
yes,
plan
we will have a plan to reopen things that will be gradual, but once we see the light at the end of the tunnel, as far as I'm concerned, the faster the better. So we are taking the precautions. Right now, Pierre Fitzgibbon, the economy minister, his job is to make sure that as soon as we have gone through this, businesses will be ready to open up again. So yes, we may choose certain sectors, certain regions, certain industries, but what I want is that once that it's all fixed, that we reopen as quickly as possible.
Quelles données, justement, pour justement que les gens
What
commencent à voir
data,
un peu
so
le
that people
visuel,
can see the end
Quelles
of the
données?
tunnel?
Je m'adresse
What
peut-être à
data,
M.
and perhaps this is more for Mr.
va vous
Arruda,
faire dire, OK,
what
là,
data is going to
ça y
make
est,
you
on est
say,
prêt
okay,
à
now we're
entamer
ready
notre
to
sortie
start
du confinement, notre,
leaving
sortie de cette
confinement,
situation-là, notre retour à la vie normale?
our return to a normal life? Well, first and foremost, it'll be the epidemiological portrait that we will see in the different regions of Quebec. And I would also tell you that it is possible, very strongly, that the way to do before COVID-19 and after will be different. That is to say, we're probably going to allow certain businesses that are more essential than others, that have rethought how they do things, either with working more from home or more distancing, to start again, to allow society to work. So there will be at once an analysis, I would tell you, from a public health point of view, from places of work, and we have people studying that, where they look at the engineering at work, the measures to protect people. So the companies that will have shown that they have reorganized things to allow functioning while protecting their employees through, for example, having less people on the premises, or working processes that are reviewed, or chains that can be operated differently, and allowing working at home. Well, these people will be able to, will be able to put those businesses back in function. And the Premier, this pause that we've decided to take is not to stop and rest. Yeah, well, yes, for certain people, but it's especially to rethink how we work. This pause. And I am convinced that through this adversity that we're all going through, we're going to transform the way that we work more and more, to even allow within a few years to get better conciliation between work and private life, because it is part of a thought process. This is really forcing us to think about how we work in different areas.
Okay. Question pour Louis Lacroix, Cogeco Nouvelles.
Bonjour, messieurs.
Hello, gentlemen.
Je comprends, là, vous avez dit
I understand that you said right from the beginning, Mr. Legault, that we were the place where we test the most in the world. We're talking about 58,000 tests up until now. But when we look at the statistics, with 142 more that we have, we're now at 5,000, or in Canada, there's 5,997 people who are infected, and we have half of those infections. So we are sadly the champions of the coronavirus right now, if we base ourselves on the numbers that you've given us. You did give us a basic explanation this week. Is this basic explanation still true? Why is Quebec so affected by the coronavirus? Is the explanation that you give this week, is it still the same, or are there others? Listen, I've told you, it is rarely, in a phenomenon as such, only one cause. We're coming back to a former period where there was traveling, and now you're going to tell me, but, people travel as much in Toronto. Well, it depends where they went. It depends on the profile of the travelers. It depends how people behaved when they came back. to be able to contain the situation. And now I really wish to tell you, and I've asked my experts this, it is too early. And we'd love to. I mean, we are the first to want to understand. But what Ontario is doing in terms of testing, its testing strategy, we have a lot of people who are tested who are between 20 and 69 years of age, and 2/3 of people who are tested between 20 and 69 years of age are people who probably have few symptoms. And I don't know what the testing strategy Ontario is employing. British Columbia is anterior to us. There are phenomena that we have to be able to analyze. And perhaps there are people who are going to want to make calculation and comparison and race and all that. I cannot give you information that could compare this in any significant way. Of course, the evolution of the pandemic, how it evolved in Quebec compared to others, how we counter, how we hospitalize, and the way that we use diagnosis, the way that we've set up the measures, all of that together has to be analyzed. And unfortunately, I know it's too bad, but it's only later that we'll be able to analyze, because even what you can see, what's written in the government as being the order, what is being practiced in the field can be different. So what is important to me, it's true that we'll be able to compare ourselves, and we want to compare ourselves. And of course, it's clear in the comparisons, there's going to be articles published on this for 5 to 6 years. What is important to me right now is that the situation is serious. We have people who are dying. We have 22 people who have died. We have people who died where we were expecting, but it is under control. If you allow me, and I don't want to get into scenarios because there's hundreds with different models, but on the basis of what we've projected in terms of our acceleration right now is below what we had planned as a scenario. We're not yet at flattening the curve, but I want you to know something. The lower we are, the later the flattening of the curve is going to come, but it's going to make it that the health system is going to work well. And if you make a curve for Montreal and a curve for the Eastern Townships and a curve for Laval and for the Côte-Nord, you will not get the same curve. And that is why right now we have an approach that is localized, regionalized. We take the decisions to protect the regions, yes, but Montreal, the Eastern Townships, and the 8 regions that have, are going to act on their own. We're not saying that we're stopping investigating cases and contacts. There are still outbreaks to be able to hold on in the RPAs and control, and perhaps neighborhoods where we have to control people moving around. We have to avoid that Montreal goes and creates an outbreak in the Laurentians. There's the entire area around Montreal. There are regions like the Montérégie, which are very big. All of that is being analyzed on a daily basis, and we have daily meetings with our public health directors. I mean, don't think that we only have press conferences. Every day we have data, every day we sit down, and every day we think about this measure and that, and adopt the ones based on the portrait and diagnosis that we have in each region. The former president of Air Transat, when we look at the flights to Europe, I remember, of course, between Quebec and France, there's a lot of flights because we have routes and people go visit France. In the rest of Canada, it's especially with Great Britain, the United Kingdom. Look at the numbers. It's surprising to see that there's a lot more, if you keep the proportion in mind, in France than in the United Kingdom. But there's also a question of evolution. The United Kingdom is not as advanced as France, but I'm not saying that it is the explanation. But as Dr. Arruda says, there are many explanations. The fact that our spring break was not at the same time as that of Ontario did not help us, because there were more people who traveled during the spring break in the worst moment, whereas Ontario saved themselves that because their spring break was coming pretty much after international travel was banned. So you have to take all of this into account. And don't worry, I, too, it's something that I'm analyzing and looking at and asking. I ask questions. Dr. Arruda, I'm sure, is finding me really annoying in the morning with all my questions. But, we try to answer these. But for the time being, it's difficult to have a detailed breakdown of the explanations. Well, Mr. Premier, annoying but really nice. Monsieur Legault, you went to have a walk yesterday. We saw you together with your wife. You respected the 2 meters. That was perfect. But there's a lot of people who did so as well. It was very beautiful in Montreal and Quebec both. And people sit on benches, for example. They take break. Should we clean all of those features? Is there a risk in sitting on urban property like street furniture using the equipment that are available for people by the city? What was explained to me is that it does not create a problem as long as you wash your hands. Don't touch your face. That is important. Change your clothes and wash your hands. I think that is what is important. Now, I can also imagine, I walked around on the sidewalks and on the Plaine d'Abraham. Of course, on the plains, it's broader and much easier to keep the 2 meters. But sometimes on the sidewalk, when a couple meets another couple, it's more difficult. So, but take the time, go one behind the other. Nobody's in a hurry. But the street urban furniture, well, you have to understand that we're asking people who have no symptoms to not go out. So somebody who has a big cold who starts sneezing on a public bench, for example, I think that, first of all, we ask them to have respiratory etiquette and not do that. So usually, you sit with your bum on a street bench. You're not going to go licking it, and you don't necessarily have to touch it either. So your pants, let's say that there are secretions there, you change it, you wash your hands. You understand? It's the high-touch zones, like the hands. If I take the metro and people don't have any symptoms and everybody has a distance, sometimes there's no distancing that's possible, but if I touch, it's possible that it was disinfected, but the last person who touched it, is contagious, but I wash my hands, and it's okay. That's what it is. It's not a virus that is going to jump on you. That's going to, the secretion that's on the floor and it's going to jump in your face. No. If you touch the bench and you start, touching your face, do you understand what I mean? Objects, yes, in homes, if somebody's sick, bathrooms, we try to control that. But that's the logic that I wanted to express to you by the illustration that I'm explaining.
Une précision et une question concernant le Nouveau-Brunswick.
Concerning New Brunswick, you spoke about it very quickly. What are the measures? And the mayor of Bécomo confirmed to us this morning that the CIUS of the Côte-Nord region was asking for the isolation of the people from Montreal if they come to the region for 14 days. Is it the case in the Côte-Nord? Is it the case in other regions? Well, we shouldn't be able to have to ask for isolation because people shouldn't be going there in the first place. I can understand, and I don't want there to be in region fighting. If somebody comes and give an essential service, but somebody who goes to just visit Bécomo, this is not a good idea. So yes, isolate themselves, but better than that, don't go there at all. That's what's important. As far as New Brunswick is concerned, all we're doing is controlling people going in, people going out. And of course, we want to limit them to what is absolutely essential. About the nursing staff, that is still, I would say, tense. There are 14 cases of nurses being isolated in Lévis right now, including a pregnant woman. Is it still the same guidelines for the women who are pregnant right now? Yes, it's the same guidelines. Each case is also being analyzed within a perspective. And I understand the worry that mothers may have and pregnant women about this infection. Thank goodness pregnant women don't have a much higher risk. I would even say, in pregnant women, the main risk is the temperature, the fever that she may have. That can be an issue. What we often do is we maintain pregnant women in functions where they won't necessarily be exposed to cases. This is a management being done with the principle of a notice that we got from Public Health of our National Institute, which was also attached with this nest, which manages preventive withdrawal. And we have to make sure that we have the essential staff. In other places, it was, for example, in intensive care as such. But as much as we can, we try to decrease exposure. However, to maintain essential services, it is possible that certain pregnant women in certain conditions that are being respected may continue to work in a healthcare setting. But that is also a decision that is being made locally depending on the capacities. What we do wish to avoid is having nurses that are doing 3 or 4 day cycles, and they're so tired that there might be errors. But we're not taking any chances. I would tell you that the measures that we're setting up, we are not taking any chances to expose any pregnant women. I would like to know why you have launched a call to the schools for them to give you the masks that they have in their possession. We've asked everyone, cities, schools, businesses, all those who have masks and medical equipment, bring it back within the medical network to be able to control the evolution correctly. Because everywhere in the world, it's being rationed. So, of course, up until now, there's no short-term concerns, but depending on what we will reach in the peak, we may need them. So we're bringing everything back that we were able to bring back. And do you know how many masks you think that you may get back in this way? Oh, I don't have the number that we've recovered, but we get the number every day that we have in our possession. We look at the usage that is done on a daily basis, and we look at the orders that are coming in today. So we're following the number of masks and the number of gloves, of gowns as well. So that's all being followed in a very detailed way. So you don't know whether it made a difference to requisition those masks? They're not huge volumes.
Bonjour, Monsieur le Premier Ministre. Le Premier ministre du Canada,
The Prime Minister of Canada, Justin Trudeau, in his conference point this morning, said that he was having a discussion with certain provinces on the role that the Canadian Army might play in certain cities or regions of the country. Have you had discussions with Mr. Trudeau about this? And what role might you think about or not for the Army in light of what was announced yesterday concerning the isolation of certain regions? For the time being, we think that with our own police forces, we can keep the isolation of certain regions. I've spoken with Dwight Ball, the Newfoundland Premier, on Friday evening so that our police officers can, work together at the border with Labrador. But Ontario, we want to be careful because between Gatineau and Ottawa, there is a chain there for medical services that it is important to keep open. So for the time being, it's under control. We do not believe that we need the Army. I'd also like to hear you about the negotiations with the unions. A few days ago, you were talking about getting to a decision quickly or an agreement. And some unions yesterday were saying that they're very far from it and that we absolutely have to put the emphasis on the health and safety of the workers. So I would like to hear you on your strategy with the unions. Do you still have the intention of getting to an agreement altogether? Or in the short or long term, what are the decisions going to be taken for health and safety? As far as I know, on the health aspect, we agree very well for the ways in which we will protect the staff. Of course, one must always be careful to use the medical equipment only when it is necessary. Now, on the payouts, we have said it since the beginning. I would say even it's been many months, even before the crisis. What we wish is to increase the wages of the healthcare attendants. It's not a simple thing. Usually in Quebec, when we negotiate wage salaries, we give the same increase to everybody, but we think, and it's even truer with the arrival of the $2,000 check per month, to have something special for the attendants. So that is part of the discussions that we're having with the unions. And I'm going to let the discussions on the table.
Vous avez dit que les...
Mr. Arruda, you said that the increase that we've seen right now in the number of cases is below the predictions, but that the curve is not yet flattened. Your predictions, we were therefore at 2,840 cases. Where were your predictions? I'm not going to give you a number for the reason that a number out of context like this doesn't explain anything. I'll just tell you, generally speaking, how we see things. You can have a curve, and now you're going to see me move my hands around like this, in this way, right? It's short, it goes up, we get rid of the virus, and everybody's sick. And in that, a lot of people die, and our healthcare system is going to be very taxed. We can have scenarios just on the basis of the data that we planned when, with different, rates. And then you can have curves like these, you can have curves like these, you can have a curve like that, and you can have a curve like this. We have curves that we've been looking at with what we install in terms of measures, and it's very difficult to tell you. And I even got a question this morning, we closed down bars, how did the bars contribute? Closing the bars contributed to. Well, listen, that's not how it works. There's social distancing measures, how many people were infected, who were in contact with other people, etc. In the community, in family meals, etc. So what we're doing is that every time, and there will be presentations, technical presentations made later once we'll have stabilized certain things, but every time we add a measure, and that rather than the curve going up this way, we spread it this way, and the more we spread in a significant way, it's possible that, we might get the plateau only after 40 days because we'll have stretched out the curve. But I can tell you about that. We had planned for certain measures. We were like this, and now we are like this, below what we were planning. For each other day, and I'm not going to give you the number. I know that you'd love to have it, but the number, without understanding everything around it, is useless. But right now, we have fewer than we thought that we had. And we're adjusting our scenario that we had planned for with the previous day's data, etc. So basically what I'm telling you is we know we're going to get cases. Don't expect that there be no more deaths and no more cases. But the speed at which we are increasing is spreading out. And the more we spread it, the more the plateau is going to take a long time to get to. The faster we go, the faster we get to this plateau, and the faster we start going low. And when it's very accelerated, we get a peak and we don't have a plateau. And when we flatten it, then you get a plateau. And by spreading it in time, we have a displacement of the curve in time, and you flatten it. I'm showing it to you so that you get it. So it's a curve, but when you flatten it down, it's tiresome because it lasts longer, but it's not as strong. And we already are seeing the effects of what we did. We said that it took 12 days, but even better, we are flattening it out further. I was hearing you yesterday saying there are days that we had increases of 24%. Well, today, 342 is an increase of 14%. So that's encouraging. It doesn't mean that today we won't go back up to 24 or even 30 or 40, but let's say that today's results for me, they are encouraging. But we cannot conclude on the basis of we can't get to any conclusion based on only one day. And if you'll allow me, Mr. Premier, even more complicated is that there are tests being done right now, so the results are not known yet. So the date where somebody becomes positive, and then there's a date at the beginning of the symptoms, so that there are curves that are portraits that we're going to see only later, where we're going to see, okay, that person was tested here, but perhaps was infected or was affected with symptoms later. So the curve retrospectively, we'll see some where we measured it in real time and others where we got the information afterwards. So what I can tell you is that globally, so that the population understand, we are. And when I say this, every day, I go to bed asking myself, what is going to be tomorrow's number? And right now, things are making it that we are not losing control compared to what we were planning. And the capacity that we have to respond, whether it be in intensive care or hospitalization beds, we have already put ourselves ahead in order not to have to do that in a 24 or 48-hour period. We are ready to receive people. And in Quebec, there are people who are hospitalized in intensive care who wouldn't be hospitalized elsewhere. We decide, since there's one room, since it's not easier to give care, there are people who go to intensive care who could be treated in another kind of unit right now. That is also perhaps from what other provinces are doing because we are in increased capacity. I know I'm taking a long time, but I was told that it was okay to do so that the population understand, and I'm taking advantage of the moment. Thank you very much. Well, quite. I think that the population is looking to understand. Monsieur Legault, you'll be happy. You love numbers. You've often said it. I'm going to give you the example of British Columbia that's been broadcasting documents that are dozens of pages long on predictions and where they're at. All of that is extremely transparent. In Quebec, I regret, but we are in the dark about the information that is given to the public concerning these questions. And I'm sorry, but that's a reality. I'd like to know, why is it like that? This has been going on for many days. And secondly, when we say that we are increasing, but not as quickly, or below the predictions, the peak, basically, when are you expecting to get to it? Well, first of all, I have read the documents of British Columbia, and what I find dangerous in the documents of British Columbia is that I am certain that they have more pessimistic scenarios as well as more optimistic scenarios, as we do. And now they gave one scenario. I prefer having many, and I prefer that we keep it to ourselves, because if we start giving every possible scenario out there, including the most pessimistic of the pessimistics, we might start making people panic. I think that what is important to say is that right now, everything is under control. And for me, the most important number, we have 192 people who are being hospitalized right now, and we have 6,000 beds that are available. So there's an entire margin here to be able to take care of people well, and that is what is important. And in our scenario, if you want to compare it to British Columbia, well, we would be okay with the 6,000 beds. So if ever it's necessary to do more, well, we'll do more. But now to start choosing a scenario, unless you're a prophet and you have a crystal ball, I find that very risky. That particular approach of giving only one scenario. I prefer having several, and I prefer that we keep them to ourselves. This is a choice we've made. I'm sorry, I find this very important what you're saying. There are many people in their basements right now, nerds that are looking at scenarios all over the place. If you want us to have a door, open for about scenarios, we're going to have 5 days. People are going to fight over the model to be used. I am convinced that there are economists and other people right now who are looking at the data that's being published in the world, and they're making up scenarios. What is important to me is not the scenarios and saying, oh, I have the right scenario and I won a prize because I got the best scenario. That's not what's important to me. What is important to me is the Quebec population, that the population does what it has to do so that we don't have any impact on our care and that our healthcare system, my colleagues in the labs that are working like crazy to do the tests, they are working at 250 miles an hour in the labs. You find that it takes a long time right now, but we're testing people. People are preparing the healthcare system to be able to do it. People are, not overusing gloves, and when we need them, so that we use them judiciously so that they have enough when comes a time. I'm not going to play games. I don't want to win the prize to say, hey, I was right. On the 14th of April, we're going to have 40,000 cases, and it's going to be exactly the right number. We're not at Loto Quebec here. We are in adequate management, and if you want us to trip over our feet in scenarios, well, we can, but not here. And be careful comparing things with British Columbia, because British Columbia is close to Asia. They were infected a lot earlier with China, also with the state of Washington. We are people who traveled, were more in Europe. We were affected later. So let's be very prudent today with comparing those numbers. We know that in China things have calmed down quite a bit, so of course that's good news for British Columbia. For us, it's a completely different dynamic. Last question in French from Caroline Plante. What is the data of people who are doing better, those who are not in intensive care, those who are no longer hospitalized, without necessarily being cured, but those who are cured as well, their profile? Mr. Arruda, we have 94 cases that are recovered, but we probably have hundreds more. Because before being able to be able to say that we had recovered, we had to have 2 negative tests. The vast majority of people, you see the quantity of tests that we made, are either going to have a cold or they're going to be able to stay at home. We'll even be able to say some people thought, didn't think that it was a coronavirus. That's still the case. The problem is for people who are 70, 80 years of age and over. We have only one case in the 60 to 69 years of age category. So it remains a disease and a category for which people will have more serious symptoms. People who are older, have diabetes, chronic diseases, it can be fatal. Also, one more thing that everybody should understand. Having tests to know whether the person no longer has the coronavirus is not a priority. I prefer testing people who have symptoms and who may have the coronavirus rather than testing people who no longer have symptoms, so that's good news, to be told that we're happy. I understand that it's comforting to know that there are people who no longer have it, but the priority right now is to test those people who have symptoms.
Switch to
English questions.
A question from Phil Autier, the Gazette. Question for Premier Legault and Dr. Arruda. We are getting calls from seniors in residences who are saying they are being kept in their rooms. They are not even allowed to take walks with supervision. These seniors are with no symptom. Is that the correct procedure?
In fact, it depends what is going on in this specific place. If there is, and I think when it's this way, it's because there have been circulation in the residency over there. And as we told you, those persons are high risk, and if they want to get out, they must be supervised. I cannot comment on a specific situation, but I would tell you when there is an outbreak with 4 people dying in that place, it's normal that people be kept in their rooms.
Another question for Dr. Arruda from Phil Autier. Can you tell us more about what is happening in Western Montreal? What neighborhoods are being affected? How much is COVID-19 spreading there?
It's clear that in that region, we call it a hot spot, or there is a higher rate of infection than comparing to other sectors of Montreal. But for those things, now, the public health director, in relation with the mayor, with all the actors and the stakeholders, will have press conferences to inform the population about which hotspots is there, what are the measures they're going to put in place, and recommend people who don't have to go to those places for essential services or healthcare issue to stay away. So, and that is going to be evolving in different regions in Quebec. And it's after the press conferences here at the provincial level that those are going to be made in different places in Quebec.
Thank you. Another question from Global, Raquel Fletcher. The governor of New York gives updates on amount of PPE every day and what's needed in the future. Why won't the Quebec government give specifics?
I think this is different strategies. I will tell you, people wants to get protection. Imagine if I say we will get millions of masks tomorrow, and everybody wants to pick up the reserves, they stole what, and we are controlling it, not because we want to control it, because this is an issue around the world. And we want to make sure that we won't miss any gowns, protection for the ones who needs to treat the ones, not for people spilling it because they are afraid, they have no symptoms at all, and we bring it. So I think it's a different strategy to make sure. What is important that the people understand is that we are having a strict work done to make sure that we don't lose the control on the masks and everything, to keep them for the ones who will need them, the patients and the healthcare and the essential services people.
Another question. Are people respecting your directive to not travel between regions, Premier?
I think so. I hope so. And since yesterday we were more clear, all the regions on the north and east of Quebec, we want to keep these regions that have not many cases this way. And we are telling people don't go to Montreal and to Estrie. And today we've asked the authority of those two places, Montreal and Estrie, to tell a bit, give more information about where the quartiers, neighborhoods are more affected in order to make sure that people don't go in those specific places.
One last question in English from CTV, Matthew Gilmore. We are hearing experts talking a lot about burnout and stress among healthcare workers. And we have seen huge jumps in the number of calls placed to mental health phone lines. How do you plan on tackling the growing mental health crisis?
Okay. We have more than 300,000 people in Quebec that had some mental health problem in the last months, and we've called all of them. So we're trying to keep in touch with the ones that are the most vulnerable, and we've added some workers, and we are very careful about healthcare services because we expect that there'll be an increase in the next weeks.
Yeah, I think it's clear. Health breaks are going to be made. We're going to have people who are retired coming back. There is a lot of people who are going to come back, and we were in the beginning of the crisis. Everybody was working hard, but now we're going to try to make people have a rest, which is necessary for them.
Sorry, we have one last question. Sorry for CBC, and I forgot you. So I'm sorry.
No
from Julia Page, CBC.
Yes, hello to both of you. I'll just start with Dr. Arruda, just because you illustrated it so well in French earlier. You said you were encouraged when you looked at the curve of the virus in Quebec. You said it was lower than you were expecting at this point. Could you maybe explain in English how you're seeing that, how the measures put in place so far maybe are responsible for that, and what it tells you looking forward, what Quebecers should do to keep that curve fairly low?
First of all, the situation is serious but under control, and what we are observing actually is under what we think will be happen. So it's making us thinking that what we put as measures very early, okay, even if we have been exposed with the school break thing differently from Montreal, from Ontario, and told comparisons are very bad. And I don't want to be the one who's going to say, here is the scenario, I win, it was what was supposed. What is important is not to win the scenario. What is important is to make sure that you remember that. We can have a pike like this, and this way it's very short, everybody's going to get sick, and our healthcare system is going to be overwhelmed like in other countries. I don't want to choose who I'm going to keep in a respirator because I don't have enough for that. Nobody wants to do this in Quebec. And I'm asking God, or everywhere I want spiritually, to don't have this scenario here in Canada, in Quebec particularly. What is happening is that we are extending the curve that we projected. Actually, we are under, okay? We have not still attained the plateau, meaning that we're going to come back, because we are stretching it, path, from this high curve. We are trying to make it stretch on time, to make us given, and even if it's different from Montreal to I would say Côte-Nord and the east and north part, because we don't want that scenario goes over there, because there is older people, there is isolated communities, they have more diabetes and everything. So in fact, even if we could have 45 scenarios, and there is people doing them everywhere in the world, the issue is, have we taken the good decisions? Are we under control? And we have actually, as the Prime Minister was saying, a big capacity, even if tomorrow there is 4, 5, 10-folds of the cases to be treated in the hospital, because we already had put intention, already take the decision to have place. And we even can have more using hotels, some hospital, I would say, easels that are closed. So, in fact, we are in action. And I want to ask and thank all the lab people And all the ones working, preparing tests, getting different things, getting masked for the good management we are doing. And I hope we're going to have a big party all together when things are going to be over. But actually, I don't want to win the scenario. I just want to flatten the curve, make it more stress, and then I would say together beat this virus, and together we need that we keep those important issues.
Could I have just one last question for Premier Legault? We saw a first case of COVID-19 in Nunavut. That's one of the regions of the province that had cut off travel a few days, weeks ago, because they were hoping to limit the spread there because of overcrowding in homes and limited access to health care. Can you tell me what Quebec can do to support the regional health board there and what kind of communications you've had?
Right now, the situation is under control in Nunavut and in all regions of the north and east of Quebec. But we know that in some places there are more vulnerable people in percentage of the population. So that's why we took this measure, and we don't want that it spread in Nunavut and in all regions up north and in the east of Quebec.
Merci infiniment. Bonne journée.
Merci, bonne journée.
Merci, vous aussi.
Oui.
Bon dimanche.
Bonne journée. Merci, M. Legault.